The night the highway turned into a graveyard, 41 patients arrived at Callaway Regional Medical Center in under 2 hours. Surgeons froze. Residents wept in hallways. The chief of trauma stood in the middle of the chaos and did nothing, because he didn't know what to do. And while every doctor with a medical degree panicked, a quiet nurse nobody had ever bothered to learn the name of walked into the bloodiest operating room in the hospital's history, picked up a scalpel, and started cutting. She didn't ask for permission. She didn't explain herself. She just worked, like someone who had done this before, in places far darker than any hospital. Before we go any further, if you're new here, hit that subscribe button and follow this channel so you never miss a story. The things that happen to ordinary people in extraordinary moments, I promise you, they will keep you up at night. Drop a like on this video and tell me in the comments what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to that night, because what happened inside Callaway Regional is something none of those doctors will ever forget. The storm came in off the mountains without much warning, the way the worst ones always do in Mill Haven, Colorado. By 6 in the evening, visibility on Interstate 74 had dropped to nothing. White wall conditions, the kind that made experienced truckers pull over and wait it out. Most of them did. But a 40-vehicle pileup doesn't require everyone to make a mistake. It only requires one. A semi-hauling construction equipment jackknifed across 3 lanes at the base of the Ridgecrest overpass, and what followed happened in under 4 minutes. Passenger cars compressed into each other like accordion folds. A fuel tanker caught and blew, not catastrophically, but enough to send fire across the median. By the time the first ambulance was dispatched, the county emergency coordinator had already declared a mass casualty event. At Callaway Regional Medical Center, the call came in at 6:17 p.m. The charge nurse at the front desk, a broad-shouldered man named Derek Yates, took the radio report with the phone pressed to one ear and his hand already reaching for the overhead PA. He kept his voice flat when he announced it. Mass casualty incoming, all surgical staff to trauma stations. Because flat was the only way to say something like that without starting a stampede. In the East Wing break room, Mara Solis was halfway through a cup of coffee that had gone cold 40 minutes ago. She was reading nothing, staring at the wall, doing the specific kind of nothing that people do when they're exhausted but too wired to sleep. She was 34 years old, and she had been working as a surgical nurse at Callaway Regional for 11 months. She had brown hair she kept pulled back so tight it looked painted on, and she had the particular stillness of someone who had learned, at some point in her life, that stillness was a form of armor. When the PA announcement broke the silence, she set down the cup, took a breath, and stood up. She didn't run. She walked, purposefully, at a pace that covered ground without announcing urgency, toward the surgical wing. In the hallway outside OR 2, she passed Dr. Gregory Farrell, the hospital's chief of trauma surgery, who was moving in the opposite direction with a tablet in his hand and the faintly hunted look of a man trying to appear in command of a situation that had not yet fully arrived. Farrell was 51, broad-faced, and had the kind of institutional confidence that came from decades of being the most important person in any given room. He glanced at Mara the way he glanced at furniture, registering her presence as an obstacle to root around rather than a person to acknowledge. "Where are the additional residents?" he said, not to her specifically, just into the air near her. "Paging them now," Derek Yates answered from somewhere behind her. Farrell moved on without breaking stride. Mara pulled a surgical cap from the dispenser on the wall and kept walking. She had been in this hospital almost a year, and in that time Dr. Farrell had spoken to her directly on perhaps 6 occasions. 5 of those times had been to correct something. The 6th time she had handed him a clamp before he asked for it, and he had looked at her the way people look at a dog that's done an unexpected trick, briefly impressed, then immediately moving on. His nurses were instruments. They handed him things. They anticipated his needs. They did not exist as people in any way that required him to consider them. She had heard what he said about her once, early on, when he didn't know she was within earshot. She'd been restocking a supply cart outside the consultation room while he spoke with one of the senior residents inside. "She's competent enough, quiet, doesn't cause problems, but there's a ceiling on people like her." She'll be handing out instruments for the next 20 years, and that's fine. That's exactly what this place needs from her. Mara had finished counting suture packets and moved on without adjusting her expression. She had learned in places far more dangerous than this hallway that the opinions of people who had never been tested were not worth the breath it took to argue against them. The first ambulances arrived at 6:44 p.m., and then the world broke open. 17 patients in the first wave. Burns, crush injuries, spinal compressions, punctured organs, one partial degloving that made a second-year resident turn away from the gurney. The ambulance bay looked like a scene from something that wasn't supposed to happen in a mid-sized Colorado city on a Tuesday night in February. Paramedics were shouting numbers, blood pressures, GCS scores, estimated blood loss. And the triage nurses were doing their best to sort the living from the almost living from the very nearly dead. Mara was assigned to OR3, supporting Dr. Kevin Ash, a general surgeon in his early 40s who was competent and steady under normal conditions. She'd worked with him before. He was the kind of surgeon who narrated his own procedures slightly, not for the benefit of students, just a habit, a way of thinking out loud that had calcified over the years. She handed him instruments, monitored the patient's vitals, and stayed out of his way. The patient was a 38-year-old woman, internal hemorrhage from blunt abdominal trauma, liver laceration identified on the field ultrasound. Standard emergency protocol. Dr. Ash had his hands inside the cavity within 4 minutes of the patient hitting the table. "Bovie," he said. Mara handed it. "More suction. She's bleeding into the field." The scrub tech increased suction. Mara watched the monitors and said nothing. The second wave of ambulances arrived at 7:12 p.m. The overhead PA announced it with the same forced calm that Derek Yates had managed the first time. But there were cracks in it now. The words came slightly too fast, the pauses between items slightly too long. Somewhere down the hall, she could hear someone's voice rising. Dr. Ash heard it too. His hands didn't stop moving, but his eyes flicked toward the OR door for just a fraction of a second. "Somebody's having a bad night," he said. "Sounds like OR1, the scrub tech said. Mara said nothing. She was watching the blood pressure readout. It had dropped 4 points in the last 90 seconds. "Her pressure's dipping," she said. "I see it. She's at 78/50. I said I see it, Solis." She stepped back and let him work. The bad night in OR1 belonged to Dr. Paul Drummond, a second-year resident who was, by most reasonable assessments, not ready to be the most senior surgeon in an operating room during a mass casualty event. But the most senior surgeon available, Dr. Farrell, had been pulled into an emergency thoracotomy in OR4, and the two other attendings on shift were both occupied. And so Paul Drummond found himself standing over a 52-year-old man with a ruptured spleen and a blood pressure that was doing something that blood pressure was not supposed to do, with two medical students flanking him like deer in a windshield. He had made 2 decisions already and was no longer confident in either of them. "Where is Dr. Farrell?" he asked the room. "OR4, they said he can't break," the circulating nurse answered. "Who else is—" "Everyone's occupied." Paul Drummond looked at the patient on the table and felt the specific, airless terror of a person who has been given authority they did not ask for and cannot return. His hands were inside the abdominal cavity. He could not put them down and walk out. There was no scenario in which he put his hands down and walked out. The patient's pressure dropped to 61/40. "He's crashing," the anesthesiologist said, with the particular flat urgency of someone who has said this phrase before and knows exactly what it means. Drummond looked at his own hands like they belonged to someone else. Mara heard it through the wall. Not the words, but the quality of silence that happens when a room full of people simultaneously realizes that the person in charge doesn't know what to do. She had heard that particular silence before, in conditions she did not think about if she could avoid it, and her body recognized it before her mind did. She looked at the monitor in OR3. Dr. Ash's patient had stabilized. He was closing. "I need to step out for a moment," she said. "I'm closing," Dr. Ash said, not looking up. "I don't need you." She walked out. The OR1 door was closed but not locked. She pushed it open. The scene inside was exactly what she'd expected. Drummond with his hands in the patient's abdomen, his face the color of copy paper, the 2 medical students pressed against the back wall, The anesthesiologist watching the monitors with the focused dread of someone who has done the math and doesn't like the answer. "What's the situation?" she said. Drummond looked at her. "Solis, you can't be in here. What's the situation?" There was something in her voice that wasn't loud and wasn't aggressive and somehow managed to be both of those things anyway. It was a voice that had been calibrated over years and in conditions she didn't discuss to cut through the specific noise of panic. Drummond told her, ruptured spleen, partial repair attempted, a bleeder he couldn't locate, pressure still falling. Mara stepped to the table. "Move your hands to the left quadrant. You're working too high." You've been chasing a bleed that isn't where you're looking. Move your hands left, compress the aorta, and give me 2 minutes." The anesthesiologist, a compact Korean-American woman named Dr. Ji-Young Park, who had been practicing for 15 years and had excellent instincts about who to listen to in a crisis, looked at Mara and said quietly, "What do you need?" "Hang 2 units, prep a third, and get me a Satinsky clamp." "You're a nurse," Drummond said. His voice had a note in it that was trying to be outrage but kept slipping into something closer to desperation. "I am," Mara said. "Move your hands left." He moved them. The clamp appeared in her hand. She placed it with the kind of mechanical precision that doesn't come from reading textbooks. The bleeder, a small arterial branch she had suspected from Drummond's description, was exactly where she'd expected it. The blood pressure began climbing within 90 seconds. Nobody in the room spoke. The monitors steadied, 74/48, then 81/52. Then a slow, laborious climb towards something that looked like survival. Drummond watched her hands. She could feel him watching, could feel the specific quality of attention in the room shifting, from panicked to arrested, from the chaos of emergency to something closer to witness. "He's going to need a splenectomy," she said. "His pressure won't hold if you try to salvage it. Do you want to complete or do you want me to get Dr. Ash?" Drummond was quiet for a moment. "Get Ash," he said quietly. She nodded and stepped back. She was at the door when Drummond spoke again. "Solis." His voice was different, not grateful, not exactly, more like a man who has just looked down and realized he was standing at the edge of something. Where did you? "I'll get Dr. Ash," she said, and walked out. The third wave arrived at 7:58 p.m. By then, every operating room in Callaway Regional was occupied. 2 of the 4 post-op recovery bays had been converted to surgical suites, and Dr. Farrell had come out of the thoracotomy to discover that his hospital had become a place he did not entirely recognize. He stood in the main surgical corridor with a tablet full of incoming patient data and the expression of someone doing rapid, unpleasant arithmetic. 11 critical patients, 6 attending surgeons, one of whom was post-procedure and flagging, 3 functional ORs, and 2 converted bays. The math did not work out. He was still doing the arithmetic when his senior nurse coordinator, a woman named Betsy Okafor, who had been at Callaway for 19 years, and had the institutional memory of a very well-organized archive, appeared at his elbow. "We have a situation in OR1, she said. "We have a situation everywhere. Specifically in OR1, Dr. Drummond's patient is being completed by Dr. Ash after a stabilization intervention by one of the surgical nurses." Farrell looked at her. "Clarify that." Nurse Solis stepped in when Dr. Drummond was unable to locate an arterial bleed and the patient was crashing. She identified and controlled the bleed before Dr. Ash arrived. Farrell stared at his tablet for a moment. "Where is Solis now?" "She's been reassigned to OR5 to support Dr. Tran with the pediatric crush trauma." "Pull her out." "Dr. Tran specifically requested ICTE? I don't care what Tran requested. I want her in front of me in 5 minutes." Betsy Okafor had worked for Gregory Farrell for 11 years. She had seen him furious. She had seen him surgical focused to the point of near autism. She had seen him gracious, and she had seen him contemptuous. She had rarely seen him rattled. The expression on his face right now was something she couldn't quite categorize. "I'll send someone to replace her in OR5, she said carefully, and went to make the call. In OR5, Mara was doing 3 things simultaneously. monitoring the vitals of a 9-year-old boy with a fractured pelvis and internal trauma, handing instruments to Dr. Lin Tran with the fluid anticipation of someone who has been in enough operating rooms to know what the next tool will be before it's asked for, and listening to the secondary hemorrhage indicators on the secondary monitor with the specific frequency of someone who knows that what the alarms don't catch can still kill you. The boy's name was Oliver. She knew this because she had read it on the intake sheet, and she had the habit of learning her patients' names because she believed, with a quiet ferocity she had never explained to anyone in this hospital, that you did better work when you remembered that the body on the table was a person. Dr. Tran was a small woman, precise and economical in her movements, Vietnamese American, third generation, trained at the University of Chicago. She was a pediatric specialist, and she was good, and she had specifically requested Mara because Mara anticipated her and did not make small talk during procedures. "Pressure holding," Mara said. "Good. I need the—" The instrument was already in Tran's hand. A brief silence that was professional acknowledgement. Then they continued. When Betsy Okafor appeared at the OR window and gestured, Mara saw it in the reflection of the instrument tray. She did not react. She waited until Dr. Tran reached a natural pause point in the procedure. Then she said quietly, "You're being asked for someone in the corridor." "I'm not done." "I know. I'll stay until you reach a handoff point." Tran's eyes moved briefly in her direction. A fraction of a second, then back to the field. 7 minutes later, when the pediatric patient's pressure had stabilized at a level Tran could comfortably hand off, Mara stepped back from the table. "He'll need a second look in 4 hours," she said. "The pelvic fracture is stable, but the secondary bleed indicators on the right side were elevated when he came in. I flagged it in the intake notes." Tran looked up from the field. This was unusual enough that the scrub tech noticed it. "You flagged it in the intake notes," Tran repeated. "Yes." "Nobody reads intake notes." "I know," Mara said, and walked out. Dr. Farrell was waiting in the corridor with his arms crossed, and the expression of a man who has formed a question and is not certain he wants the answer. Mara stopped in front of him. "Betsy said you wanted me," she said. "What happened in OR1? It wasn't a question. She answered it as a question anyway, briefly, factually, without embellishment. Drummond's situation, the arterial bleed, the clamp placement, the handoff to Ash. Farrell listened with the stillness of someone who is processing information that is reorganizing things he thought he knew. "Where did you learn to place a Satinsky clamp under active hemorrhage?" he said. She looked at him. The corridor around them was loud. Gurneys moving, people shouting inventory needs, the ambient chaos of a hospital in a genuine emergency. But between the two of them, in that particular square foot of hallway, it was very quiet. "I've been in operating rooms before," she said. "As a nurse." "Yes." He studied her for a long moment. She had the unusual quality of not shifting under scrutiny. Most people made small adjustments when someone stared at them, subtle postural changes, small tells. She was simply still. It was the stillness of someone who had been evaluated by people with considerably higher stakes than this, and had learned that stillness was the only appropriate response. "I need you in OR2, he said finally. "Vascular trauma. Dr. Reeves is in there. He's a competent surgeon, but this is a common femoral artery laceration, and we don't have the right set, and his hands are too large for the field." She looked at him for a moment. "You want me to scrub in?" "I want you to support Dr. Reeves in whatever capacity the situation requires," he said carefully. She recognized what he was doing, building himself a technical disclaimer, a version of events where he had not told a nurse to operate. She did not point this out. "All right," she said. She was 3 steps down the corridor when he called after her. "Solis?" She stopped without turning. "The intake note on the pediatric patient," he said. "Did you do a secondary bleed assessment on intake?" A pause. Around them, the hospital screamed and moved. "Yes," she said. "That's a physician assessment protocol." "I know." She walked on without turning around, and he did not call after her again. Boppum. OR2 was the worst room she had walked into that night. Dr. Marcus Reeves was a cardiovascular surgeon with 22 years of experience and hands that were, as Farrell had noted, built for work in larger fields. He was not panicking. Reeves was not a man who panicked. He was a man who pushed forward through difficulty with a determination that was impressive and, in this specific situation, slightly dangerous. The patient, a male, early 40s, femoral artery laceration from road debris, was bleeding into the field at a rate that Reeves was managing but not controlling, and the geometry of the exposure made Reeves' instruments collide with each other in ways that were costing time. Mara assessed it in under 10 seconds. "Dr. Reeves," she said. "I know," he said, not looking up. "The exposure is wrong. I can't get the angle without— Move your retractor 12 degrees counterclockwise. I'll go distal." He stopped, looked at her. She was already at the table. There was a moment, 2 seconds, maybe 3, that lasted longer than that inside the room. Reeves was a man with 2 decades of surgical authority and the instinct to protect his jurisdiction that came with it. She watched him do the math, the same rapid, uncomfortable math that Drummond had done, that Tran had done, that Farrell was doing somewhere down the hall. The math where you weighed your pride against the patient bleeding on the table in front of you. He moved the retractor. She went distal, and her hands went into the field with the kind of certainty that could not be faked or studied from a book. The certainty of someone who had operated in conditions where hesitation was a death sentence, where there was no attending to call, where the person who knew the most in the room was the only person in the room, and the nearest backup was 40 minutes by helicopter on a clear day. The field cleared. Reeves exhaled. Not a sigh of relief exactly, more like the release of a held tension he hadn't been aware of. "Where?" he said quietly, not as an accusation, just as a man needing to understand something. "Did you come from?" Mara's eyes were on the field. "Millhaven? Originally," she said. He almost laughed. It was too strange a night for full laughing, but the corner of his mouth moved, and he went back to work. And for the next 40 minutes they operated together with the wordless efficiency of people who have somehow, inexplicably, been in rooms like this before. When the patient was closed and Reeves was peeling off his gloves, he looked at her across the table. She was logging the procedure details on the intake sheet, writing in the small, densely informative shorthand she used for notes. Not the official charting, just her own notation, the habit of someone who had learned to document because documentation saved lives, and also sometimes because it was the only record that anything had happened at all. "Solis," he said. She looked up. "What I just watched you do in this room—" He stopped, reformulated. "I've worked with residents, fellows, attendings from 3 different countries. What I just watched was it's not something you learn on a hospital floor." She held his gaze. "The patient is stable," she said. "I'll put the field assessment in the post-op notes." She walked out. By 9:30 p.m., the storm had begun to ease slightly, which meant the highway was passable, which meant the final ambulances from the secondary accident sites had arrived, and Callaway Regional had processed, in 3 hours and 14 minutes, 37 patients, 11 of whom had been critical on arrival. 11 critical patients. 11 who had survived. In the surgical corridor, the attending physicians gathered in the kind of loose, exhausted cluster that forms after mass casualty events. People who have been running on adrenaline for hours, finding that the adrenaline is now departing and leaving behind a bone-specific tiredness that goes all the way to the marrow. They spoke in low voices. The overhead lights felt too bright. Dr. Farrell stood slightly apart from the group, holding a tablet he wasn't reading. He was reading instead the post-op notes that had been filed in the last 4 hours from 5 different operating rooms. Notes that were— the word that kept presenting itself to him was precise, not the ordinary clinical precision of hospital charting, something beyond that. Anticipatory. The notes didn't just document what had been done. They flagged secondary risks. They cross-referenced interventions. They showed the structure of someone who had been tracking 5 patients simultaneously in a way that his department simply did not require of its nursing staff. He pulled up Mara Solis's personnel file. Employment date, March 14th of the previous year, 11 months. Prior employment? A 2-year position at a rural clinic in eastern Colorado. Before that, a gap. 8 years. The gap was listed on her application as personal leave following military service, and the section for military service contained 3 items: branch, army, dates, a 9-year range ending 6 years ago, and rank simply listed as captain. Farrell looked at the word captain for a long moment. He pulled up her application letter. Standard. Competent. Expressed a desire to return to medicine in a lower-pressure clinical environment. Lower pressure. He thought about her hands in the femoral field. He thought about the Satinsky clamp. He thought about the intake note on the pediatric patient, the secondary bleed assessment that wasn't required and had been done anyway with the kind of diagnostic thoroughness that residents with 5 years of training sometimes couldn't manage. He set the tablet down on the nurse's station counter. Betsy Okafor appeared beside him with the quiet efficiency of someone who had been watching him the way she watched everything, attentively, from a professional distance, cataloging. "The surgical outcomes tonight," she said. "I know," he said. "Do you want to know how many of the critical interventions in rooms 1, 2, and 3 directly involved Nurse Solis?" He looked at her. She held up 3 fingers. He was quiet for a moment. "Where is she now?" he said. "She's in post-op recovery, monitoring the pediatric patient. She's been there for the last 40 minutes. She's off shift." "She's aware of that." He stood there another moment. Down the corridor, one of the second-year residents was sitting on the floor with his back against the wall and his eyes closed. Not asleep, just no longer capable of standing. Farrell noted it with the part of his brain that was always noting things, then let it go. "Pull her full military service record," he said quietly. "Whatever's available. And get me the Army Medical Corps personnel database contact." Betsy Okafor had been at this hospital for 19 years. She was not easily surprised, but something moved in her expression. Not surprise exactly. More like the recognition of a thing she had already suspected. "Tonight?" she said. "Tonight," he said. She nodded and moved away. Farrell stood in the corridor a moment longer, alone with the overhead lights and the receding noise and the list of 11 patients who were alive, who, by any reasonable assessment of the night's conditions, should not have been. He thought about the woman he had spent 11 months not thinking about, the nurse who handed instruments and followed orders and kept her eyes down and, apparently, on 3 separate occasions in the last 4 hours, had walked into rooms where people were dying and done things with her hands that she had no business being able to do. Lower pressure clinical environment. He picked up the tablet again. The Army Medical Corps database required a credentialed request. He was a credentialed physician at an accredited hospital. The request would take 48 hours minimum to process, assuming someone at the other end picked it up quickly, which they might not. Or he could do something simpler. He could walk down to the post-op recovery bay where a woman who had just saved an indeterminate number of lives was sitting off shift beside a 9-year-old boy's bed, monitoring equipment she was not required to monitor, and he could ask her. He had never asked Mara Solis anything about herself. In 11 months. He had corrected her once, regarding instrument placement protocol. He had given her shift assignments through Betsy. He had said good work perhaps twice, the way you'd say it to a piece of well-maintained equipment. He walked toward the recovery bay. Through the window in the door he could see her. She was sitting in the chair beside the pediatric patient's bed, her elbows on her knees, her eyes on the monitor. She was not on her phone. She was not doing paperwork. She was watching the numbers on the monitor with the focused patience of someone who had learned, in conditions she did not discuss, that watching was the work, that the numbers told you things if you were still enough to let them, and that stillness cost nothing and sometimes cost everything. She did not look like a woman who had spent the last 4 hours being the most capable person in multiple rooms. She looked like a woman who was tired and who was not going to leave until she was sure the boy was stable. Farrell pushed open the door. She heard it and turned her head, and for a fraction of a second before her expression settled into its customary calm, he saw something cross her face. Not fear exactly, and not guilt, and not defiance. Something older than any of those things. The expression of someone who has been doing something they thought was secret and has just understood that it is no longer secret and is now calculating what that means. "Dr. Farrell," she said. "Solis?" He stepped into the room. The monitor beside the boy beeped steadily. Outside the window, Millhaven was dark and cold. The highway wreckage still being cleared, the storm finally beginning to exhaust itself against the mountains. "I think," Farrell said slowly, "that you and I need to have a conversation that is significantly overdue." She looked at him. She said nothing. He pulled up the other chair in the room, the family chair, the one for people waiting for news, and sat down across from her, and for the first time in 11 months, Gregory Farrell actually looked at the woman who had been standing quietly in his operating rooms, handing him instruments and waiting for him to notice that she knew exactly what he was doing wrong. "Tell me," he said, "who you actually are." The monitor beeped. The boy breathed. Outside, the last of the storm's wind moved through the parking lot and was gone. Marasolis looked at the man who had spent a year not seeing her and made a decision about what to say next. She didn't answer right away. That was the first thing Farrell noticed. Not the hesitation itself, but the quality of it. Most people, when confronted with a question they don't want to answer, fill the silence immediately. They deflect, they redirect, they produce some version of an answer that isn't quite the truth, but moves the conversation away from the point. Marasolis sat with the question in the air between them, the way someone sits with a weight they've been carrying long enough that they've learned the exact shape of it. And she looked at the monitor once, checking the boy's pressure, automatic, involuntary, before she looked back at him. "How much do you actually want to know?" she said. It wasn't defiant. It was a genuine question, the kind that comes from someone who has answered it before and has learned that the answer changes depending on who's asking and why. Farrell leaned forward with his elbows on his knees. He was tired in the way that post-major event tired felt, not sleepy but hollowed out, the kind of exhaustion that lives behind the eyes. "Everything," he said. "Start wherever you need to." She was quiet another moment. Then, "Army Medical Corps, 9 years. I deployed 3 times, twice to active combat zones, once to a joint operation in a region I'm not going to name because the classification status is still ambiguous, and I don't feel like dealing with that conversation tonight." Farrell said nothing. He let the silence do the work. "I was a trauma surgeon," she said. "Not support staff, not a field medic. I ran a forward surgical team in the second deployment. 8 people. We operated out of a structure that had been a schoolhouse about 6 weeks before we got there. No proper OR lights, no climate control. The nearest blood bank was 40 miles back, and the road was mined on Tuesdays and Thursdays." She paused. "I learned to work with what I had, which was usually not enough, and the patients were usually worse than anything that comes through a hospital, and the decision about who you could save and who you couldn't was not a triage protocol. It was a choice you made and then lived with." The monitor beeped. The boy shifted slightly under his blanket. "Why did you leave?" Farrell said. She looked at the boy. "I lost someone on the table," she said. "Someone who mattered. And I made a decision in the middle of that procedure that I have thought about every day since, and I don't know. I have never been able to decide whether it was the right decision or not. That ambiguity." She stopped. "It's not something you can keep working around. It's just there. So I left. I took the nursing certification because I needed to work, and I needed it to be medicine, and I needed it to not be surgery. And that worked for about a year before I realized that what I'd actually done was trade one kind of pain for a different kind." Farrell was quiet, the kind where you stand in the corner and hand people clamps, he said, not unkindly. "Yes." Outside in the corridor, someone walked past with a cart that needed its wheel looked at, a rhythmic, slightly offbeat squeak that faded down the hall and disappeared. "You should have disclosed your surgical background on your application," he said. "I disclosed my military service." "You disclosed that you were a captain in the Army Medical Corps. You did not disclose that you were a combat trauma surgeon with—" He stopped. "How many procedures?" She looked at him. "Hundreds," she said. "I stopped counting the 3rd deployment." He stood up. Not in anger, in the specific restlessness of someone who needs to move because sitting still with certain information is physically uncomfortable. He walked to the window, looked at the parking lot, came back. "You performed 3 separate surgical interventions tonight in my hospital," he said. "Assisted," she said. "The attending surgeons—" "Don't do that." His voice was sharper than he intended. He pulled it back. "Don't manage the language with me. Not tonight." She looked at him with an expression that was not quite apology and not quite defiance and was instead something he didn't have a clean category for. "The patients are alive," she said. "Yes," he said. "They are." He exhaled. "I'm going to need to report this to administration. You understand that?" "I expected that." "There will be a review." "I know." He looked at her. This woman he had spent 11 months not thinking about, who had spent 11 months in his hospital doing exactly what she was told and nothing more, right up until the moment when doing exactly what she was told would have meant watching people die. "Why didn't you say anything?" he said. "At any point, when you were hired, when you've been in these rooms, when I—" He stopped himself before he said, "when I talked about you like you were furniture," because he was not yet ready to say that out loud. "Why didn't you tell anyone?" She tilted her head slightly. It wasn't a shrug. It was more economical than that. "Nobody asked," she said. "Yeah." The administration call happened at 11:15 p.m. after the last critical patient had been transferred to the ICU, and the recovery bays had been cleared to functional status. Farrell made it himself from his office, with the door closed. The person on the other end was Leonard Voss, Callaway Regional's chief operating officer, who had been reached at home and was operating on the particular frequency of a man who has been woken from sleep by institutional crisis and is trying to determine, before he commits to any position, exactly how bad the liability is. "She performed surgery," Voss said. It was not a question. He was saying it carefully, testing the shape of the words. "She intervened in 3 critical situations that were exceeding the capacity of the available physician staff," Farrell said. "Every patient survived. The post-op indicators are positive across the board." "Gregory," Voss's voice had the patient's slightly exhausted tone of a man who had been having legal risk conversations for 20 years. "She performed surgery without a medical license. Regardless of the outcomes, she has a medical background that she didn't fully disclose on her application. She is a nurse." Each word landed separately. Whatever her background, her current credentialing at this hospital is as a surgical nurse. The moment she stepped outside that scope, we have a liability event. I don't care how many patients she saved. The board will care. The insurance carrier will care. The state medical board will absolutely care. Farrell was silent. "I'm going to need her suspended pending review," Voss said. "Tonight, before anyone talks to the press or anyone files an incident report that I haven't reviewed first. It's midnight, which is why I'm telling you to handle it now while it's still internal." A pause. "I'm sorry, Gregory. I know that's not what you want to hear, but you know how this works." Farrell set the phone down on his desk without hanging up, stared at the ceiling for a moment, then picked it back up. "I'll handle it," he said, and ended the call. Gowns. He found her in the locker room hallway at 11:40 p.m., pulling on her coat. She'd changed out of scrubs. She had a bag over one shoulder and the look of someone who has been awake for 14 hours and is finally, reluctantly, accepting that the night is over. When she saw his expression, she stopped. "How bad?" she said. He told her. "Suspension pending administrative review. Formal incident report to be filed with the Colorado Medical Board. Possible scope of practice violation." He said it plainly, without softening it, because she was not a person who appeared to need things softened. She listened without changing her expression. "Okay," she said. "There may be consequences beyond the review. If the medical board escalates, I know what the medical board can do." Mara. It was the first time he had used her first name. He heard it himself as it came out and registered the awkwardness of it, the belated familiarity of it. She noticed, too. Something shifted minutely in her face. "I'm going to advocate for you in the review. What you did tonight was—" "Don't," she said. He stopped. "Don't advocate for me by telling people what I did tonight was exceptional," she said. "Advocate for me by telling people what would have happened without it. Those are different arguments, and only one of them actually matters." He looked at her for a moment. "You've done this before," he said. "Argued a case like this." "I've watched people argue cases like this," she said. "About me, in other contexts." She picked up her bag. "I'll come in tomorrow for whatever the process requires. I assume you'll have Dr. Reeves or Dr. Ash available to confirm the incident details. Reeves has already submitted a supporting statement, Farrell said. I didn't ask him to. He did it voluntarily he checked his watch, at 11:02 p.m., which was approximately 40 minutes after he closed the patient. Something crossed her face. Not surprise exactly, more like something she had not expected and was not entirely sure how to receive. Tell him thank you, she said. She walked out. He stood in the hallway alone and thought about the fact that she had thanked Reeves, who she'd worked with for 40 minutes, and had not asked what Farrell himself intended to do, which suggested either that she had no expectations of him or that she had already calculated his likely response and found it insufficient, and either way, he was not sure which possibility bothered him more. The next morning was gray and bright simultaneously, the particular quality of Colorado light after a storm, where the sun comes back too hard off the snow and everything looks overexposed. Mara was in the Callaway Regional Administrative Corridor by 8 a.m., sitting in one of the chairs outside Leonard Voss's office with her coat folded in her lap, and the particular quality of patience she carried that was not passivity. It was the patience of someone who has waited out much longer and harder things than this, and knows that the quality of your waiting is part of the argument you're making. She had been home for 6 hours. She had slept for 4 of them. She had woken up before the alarm and made coffee and sat at her kitchen table in her apartment, which was small and extremely organized, and she had thought about the boy, Oliver, 9 years old, pelvic fracture and internal trauma. And she had thought about the man with the femoral laceration, the woman with the liver injury, the man whose spleen she'd stabilized while Drummond stood there running out of road. She had thought about all of them for approximately 20 minutes, which was more than enough, and then she had gotten up and gotten dressed and driven back. Leonard Voss appeared in his doorway at 8:17 a.m. He was a tall man in his late 50s, silver-haired, with the slightly compressed look of someone managing institutional stress across a broad front. He looked at her over his reading glasses. "Nurse Solis," he said. "Mr. Voss. Come in." The office smelled like old coffee and carpet, and the particular slightly stale air of rooms where difficult conversations happened regularly. He had a woman with him whom Mara did not know, mid-40s, dark blazer, a notebook open on her lap. Voss introduced her as Patricia Holm, from the hospital's Legal and Compliance Office. "She's here to document the preliminary review discussion," Voss said. "That's fine," Mara said. They sat. Voss folded his hands on his desk and looked at her with the expression of a man who has decided, in advance of the conversation, how it ends. "I want to be straightforward with you," he said, "and I want to be fair. What you did last night, the interventions in OR1, OR2, and with Dr. Ash's patient, was, from a human outcomes perspective, extraordinary. I won't minimize that." "But," Mara said. He paused at the interruption, then continued. "But the hospital's credentialing system exists for reasons that apply regardless of individual capability. You are licensed in this state as a registered nurse with surgical specialization. Performing operative procedures under any framing is outside that scope. The Colorado Medical Board will be receiving a notification today, regardless of my recommendation, because once the incident reports were filed, that notification became legally mandatory." "I understand," she said. "I want to give you the opportunity to explain your actions and provide any context that may be relevant to the internal review." She looked at him. She thought about what she'd said to Farrell the night before. Advocate for me by telling people what would have happened without it, and she decided to take her own advice. "Patient 1, OR1, she said. Paul Drummond's patient was in hemorrhagic shock with a pressure of 61/40 and a bleed that had not been controlled in approximately 9 minutes of active intervention. The closest available attending was occupied in a thoracotomy. The patient's survival window, based on his pressure trajectory, was between 4 and 7 minutes. The bleed was controlled in under 3 minutes after my intervention. Dr. Ash completed the procedure." She paused. "Patient 2, OR5, pediatric. I assisted Dr. Tran, who retained full surgical authority throughout. I did not perform a procedure. I flagged a secondary bleed risk on intake that Dr. Tran is confirming this morning in her post-op report." She paused again. "Patient 3, OR2. Dr. Reeves retained surgical authority. The issue was exposure geometry, not surgical incapacity. My role was to create adequate field access. His statement, filed at 11:02 last night, describes it in those terms. Voss and Patricia Holm looked at each other. "You've prepared this," Holm said. "I drove in at 7:45, Mara said. "I had time." A silence. "Your military record," Voss said carefully. "Dr. Farrell mentioned you were Army Medical Corps." "Yes." "He mentioned something about a surgical role." "I was a trauma surgeon in the Army Medical Corps for 9 years," she said. "Deployed twice to active combat zones, once to a joint theater operation. I ran a forward surgical team in my second deployment. I have performed several hundred procedures under field conditions, many of which were more complex than what happened in this hospital last night." She said it without emphasis, just information. "My Army records are available through the military personnel database. Dr. Farrell has already submitted a request." Voss sat with that for a moment. "Why?" he said slowly. "Did you not disclose a surgical background when you were hired?" She looked at him. "I disclosed my military service and my current licensing. I applied for a nursing position, not a surgical one. Everything I disclosed was accurate. It was incomplete. It was responsive to what I was asked." She let that land. "Nobody asked me what I had done before the Army." Patricia Holm was writing in her notebook. Voss was looking at his folded hands. "I want you to understand," he said, "that the review process is going to be involved. The medical board notification alone will trigger a formal investigation. The hospital's insurance carrier has already been informed. There is a real possibility—" He stopped, chose his words. "There is a real possibility that regardless of how the internal review resolves, external regulatory consequences may result in changes to your employment status here." "I know," Mara said. "You don't seem—" He stopped again. "Frightened?" she said. He didn't answer. "I'm not going to lose my nursing license over this," she said. "The evidence doesn't support that outcome. The medical board will review the crisis conditions, the patient outcomes, the supporting statements from Dr. Reeves and Dr. Farrell, and the fact that attending surgeons were present in 2 of the 3 situations and did not object to my involvement in real time. They may issue a citation. They may not." She paused. "What I'm more interested in is whether this hospital intends to make a public statement before it has the facts. Because if it does, the story will be that a veteran combat surgeon was penalized for saving 11 people's lives. And that is a story that will not play well in the press or in this community." The room was very quiet. Patricia Holm had stopped writing. Voss looked at her for a long moment with an expression she couldn't fully read, something between irritation and a reluctant particular kind of respect. "Is that a threat?" he said. "No," she said. "It's a prediction. I don't make threats. I tell people what I think is going to happen so they can make informed decisions." She stood up and picked up her coat. "I'll be available for the formal review whenever you schedule it. If there's documentation you need for my military service, I can authorize the release today." She paused at the door. "The boy's name is Oliver. He was admitted last night with a pelvic fracture and internal trauma. He's 9 years old. His secondary bleed indicators were elevated on intake, which I flagged in the notes. Someone should check on him this morning." She walked out. The hallway outside Voss's office was long and institutional, with the particular acoustic quality of administrative corridors everywhere. Her footsteps slightly too loud, the overhead lights slightly too fluorescent, the framed hospital mission statements on the walls slightly too sincere. She walked to the elevator and stood waiting for it with her coat folded over her arm. She had held it together in there. She knew that. She had been precise and strategic, and she had placed her arguments where they needed to land. And none of that was dishonest. None of it was manipulation. It was just the application of skills she had spent years developing in situations where the consequences of a failed argument were considerably more immediate than an employment review. But her hands, she noticed, were not entirely steady. She put them in her coat pockets. The elevator opened. She stepped in. The truth was, and she would not have said this to Farrell, and she certainly would not have said it to Voss, but it was true. The truth was that she had been terrified last night, not during the procedures. During the procedures, the training took over and there was no room for terror. There was only the field and the instruments and the patient and the sequence of decisions that had to happen in the right order. But in the spaces between rooms, in the 10 seconds it took to move from one corridor to the next, in the moment before she pushed open each OR door, there had been something living in her chest that she recognized and did not have a clean name for. Not fear of the work, fear of what the work meant, fear of the thing she had buried 6 years ago rising back up in the shape of a scalpel in her hand, telling her that she had never actually left it behind, that the operating room was where she lived in the truest sense, and that all the quiet months of handing instruments and lowering her eyes and telling herself she was protecting something, all of it had been a fiction she'd constructed because the real thing was too large to look at directly. The elevator opened on the main floor. She walked through the lobby toward the main exit, and she was almost there when she heard her name. She turned. Paul Drummond was standing near the information desk. He was in street clothes. He'd been off shift for hours and presumably had not slept, and he looked like a man who had made a decision to do something and was in the process of regretting it and doing it anyway. "I heard about the review," he said. "The administrative thing." "It's a standard process," she said. "I'm filing a statement," he said. "For your review. I already drafted it." She looked at him. "You don't have to do that," she said. "I know." He shifted his weight. He was maybe 27, 28. He had the specific look of a second-year resident who had been confronted, in a single night, with the gap between how good he thought he was and how good he needed to be, and was still in the early stages of integrating that information. "I was the one in OR1, my patient, my—" He stopped. "What you did in there, what you said. Move your hands left, 2 seconds. That's all it was." She waited. "He would have died," Drummond said. "Not could have. Would have. I know that. I've been thinking about it all night, and that's what I keep coming back to. I didn't know what I was doing, and I didn't know, and that's a thing I have to figure out how to carry." He looked at her directly. "But you shouldn't be the one paying for it." She was quiet for a moment. "Send the statement to Patricia Holm in compliance," she said. "Copy Dr. Farrell." He nodded. "Thank you," she said. The same words she'd asked Farrell to pass to Reeves. She meant them both times. She walked out into the cold. The Colorado Medical Board's notification arrived at Callaway Regional at 2:14 p.m. that afternoon, which was faster than Voss had expected and faster than Farrell had hoped. The board's initial letter was a formality: acknowledgement of the incident report, formal opening of a scope of practice inquiry, request for documentation within 15 business days. What was not a formality was the second communication that arrived 40 minutes later. This one not from the medical board, but from a number that showed up as a Fort Collins area code on Farrell's desk phone. And when he picked it up, the voice on the other end introduced itself as Lieutenant Colonel Dana Price, Army Medical Command, and said that she was calling regarding a personnel records request submitted the previous night concerning a Captain Marasolis, and that before the hospital processed any further inquiries or submitted any further regulatory filings, she would appreciate the opportunity to speak with whoever was handling the situation on Callaway's end. Farrell said he was the one handling it. Lieutenant Colonel Price said she was aware of that. She said she was also aware of the incident at Callaway Regional the previous night, which Farrell found surprising, and then she said something that stopped him completely. She said that Captain Solis's military record was partially classified, that the full scope of her service was not reflected in the standard personnel database, and that if the hospital or the medical board intended to use the absence of disclosed information as the basis for a disciplinary action, they were going to encounter complications that the Army Medical Command would very much prefer to handle proactively rather than reactively. Farrell said carefully, "What kind of complications?" Lieutenant Colonel Price was quiet for a moment that felt longer than it was. "The kind," she said, "where the record that does exist understates things considerably." Farrell sat down. "I think," he said, "you should come here." "I'm already in Millhaven," Price said. "I've been here since this morning." Lieutenant Colonel Dana Price was already in Millhaven. Farrell sat with that for 3 seconds after the call ended, which was 2 seconds longer than he usually needed to process information. Then he called Voss. Voss did not take it well. "The Army," he said. "Army Medical Command. A lieutenant colonel. Why is Army Medical Command involved in a scope of practice review at a civilian hospital? That, Farrell said, is what I intend to find out. He told Voss to hold the medical board documentation, not withdraw it, just hold the submission pending the meeting with Price. Voss pushed back. Farrell reminded him that submitting incomplete information to a regulatory body while a relevant party was actively trying to provide additional context was exactly the kind of decision that created liability rather than resolving it. Voss went quiet for a moment and then said, "Fine, 24 hours," and ended the call. Price arrived at Callaway Regional at 3:30 p.m. She was not what Farrell had pictured. He'd imagined, without fully realizing he was imagining, someone more performatively military, stiff posture, clipped speech, the general presentation of institutional authority arriving to assert itself. Price was compact and somewhere in her late 40s, with close-cropped gray hair and the kind of face that had been outdoors in difficult weather for enough years that it had settled into a particular permanent readiness. She was in civilian clothes, dark slacks, a wool coat, but carried herself with the specific economy of someone who does not waste movement. She shook his hand, declined coffee, and sat down across from him in his office without looking around the room the way most visitors did. She put a folder on the desk between them. "I'm going to tell you some things that are going to change how you're thinking about this situation," she said. "Some of it I can document and some of it I can't, and the parts I can't, you're going to have to decide how much weight to give them based on the parts I can. Is that understood?" "Go ahead," Farrell said. She opened the folder. What she showed him first was the standard service record, the version that had been in the personnel database, the one he'd seen a partial summary of the night before. Captain Marasolis. Army Medical Corps, 9 years, 3 deployments, honorable discharge. He'd already seen the outline of it. Then she turned to the second page. "This is the supplemental record," Price said. "It's not classified in the full sense, it's not intelligence sensitive, but it's restricted from the standard database because the operations it references involve unit designations and theater details that the Army prefers not to publicize. What it shows is that Captain Solis's second and third deployments were not with standard medical support units." She paused. "She was assigned to a special operations surgical support role, forward surgical team embedded with a Tier 2 unit operating in a denied area. She was the only trauma surgeon within a 40-kilometer radius for the majority of that deployment, and the forward operating base she worked out of was not a protected medical facility under any conventional definition. It was a converted structure in an active combat zone that came under direct fire on 4 separate occasions during her time there." Farrell looked at the page. "She operated during active fire," he said. "On 2 of those 4 occasions, yes." Price said it the way people say things that are too large for emphasis to add anything to them. "The surgical bay took shrapnel damage during the second incident. One of her team members was wounded during the procedure. She continued the operation." The office was very quiet. "The third page," Price said, "is a summary of her commendations. Silver Star, 2 Bronze Stars with Valor device, Army Commendation Medal with Valor. These are not disclosed on the standard personnel record because the operations they reference are unit sensitive." She looked at Farrell. "The Silver Star was for an action during her 3rd deployment that I am not going to detail beyond saying that it involved a mass casualty event in conditions significantly more complicated than what happened in this hospital last night." Farrell looked at the commendation summary for a long moment without speaking. "She told me she lost someone," he said, "on the table, that it was why she left." Price's expression shifted. Not much, but enough. Something moved behind her eyes that was more personal than professional. "Yes," she said. "You knew her," he said. It was not a question. Price was quiet for a moment. "I was her commanding officer for the first 2 years of her second deployment," she said. "I knew her work better than almost anyone." She stopped. The soldier she lost was a close member of her team. She'd operated on him twice before, successfully, earlier in the deployment. The third time, it was a situation where the resources she needed weren't available, and the decisions she had to make were impossible, and the outcome was... She stopped again. The Army's investigation found no fault. Her medical decisions were within protocol given the conditions. She knew that. It didn't help. Farrell sat back in his chair. "What do you need from me?" he said. I need you to understand what you actually have here, Price said, before you let an administrative process make a decision that can't be undone. She tapped the folder. The medical board notification went out this morning. I'm not asking you to retract it. I understand the reporting obligation. What I'm asking is that when you submit your supporting documentation, you include this. She slid the folder across the desk. All of it, and that the hospital's formal position reflect what the outcome data actually shows, rather than the scope of practice framework that was written for situations that are not remotely similar to what happened here. The board will still investigate, he said. Investigations have outcomes, she said. I'd like this one to have the right one. He looked at the folder. Does she know you're here? He said. No, Price said. And I'd appreciate it if you gave me the chance to tell her myself before anyone else does. Mara was at home when Price called. She was sitting at her kitchen table with a cup of coffee that was, again, going cold, because she had the habit of making coffee and then not drinking it while she thought about things. She had been home for 2 hours. She had been thinking for most of them. When her phone showed a number she recognized from Fort Collins, her whole body went still in a way that was different from her ordinary stillness. She answered it. Dana, she said. Mara. Price's voice on the phone was the same as it had always been. Direct, not warm exactly, but carrying a register of something that functioned like warmth, even if it was technically just professional familiarity. I heard about last night. It gets around. Mass casualty event, 11 critical survivors, 1 surgical nurse behind most of the outcomes. Yes, it gets around. A pause. I'm at Callaway Regional. I've been with Dr. Farrell. Mara was quiet. You brought the supplemental record, she said. I did. I didn't ask you to do that. I know you didn't. Price's voice was level. I did it anyway. You can be angry about it later. Right now, I need you to come back to the hospital. Dana. The administrative review has shifted. Voss is reconsidering the framing. Farrell is on your side, which matters more than you're giving it credit for. And there's a board of directors emergency session being called for tomorrow morning because apparently 3 physicians submitted supporting statements in the last 6 hours, and the hospital's legal team has identified a problem with trying to discipline a decorated combat surgeon for practicing medicine during a declared mass casualty event. Mara pressed 2 fingers against her temple. Who's the 3rd statement? She said. I know Reeves and Drummond. Who's the 3rd? Dr. Tran, Price said. She submitted a 12-page statement with annotated post-op data at 1 p.m. A silence. 12 pages, Mara said. She was specific, Price said, and for the first time there was something in her voice that was, if not quite amusement, at least adjacent to it. Come back. This isn't over, but it's moving, and you should be here while it moves. Mara looked at the cold coffee. Give me 20 minutes, she said. The board of directors' emergency session was not until the next morning, but the conversation that mattered happened that evening in Farrell's office, with Price and Farrell and Voss and Patricia Holm and Mara, all of them arranged around the conference table that was technically in the corner of Farrell's office and was usually covered in journals and case files, which Farrell had moved to the floor in preparation for this specific meeting. Voss had spent the afternoon with the supplemental military record and was displaying the particular energy of a man who has been forced to revise a position he'd already committed to and is trying to do so in a way that doesn't look like revision. The hospital is not, he said carefully, in a position to advocate against a decorated military veteran who intervened in a life-threatening emergency in good faith based on extensive trauma surgical experience. That's a more accurate framing than what you had this morning, Mara said. Voss looked at her. I want to be clear that this doesn't resolve the credentialing question. Your current license is a registered nurse license, she said. Yes, I know what it is. The pathway to surgical privileges at this hospital requires an application, review of credentials, demonstration of competency, board approval, she said. I know the pathway. I've read the bylaws. I read them when I was hired. She looked at him steadily. I read them because I thought at some point it might become relevant. A pause. You were planning for this, Farrell said. Not an accusation, more like a man fitting a piece into a pattern that had just become visible. I was living my life, she said. But yes, I knew who I was when I took this job. I knew what might happen if a situation arose that required more than what my current license covers. I made a choice to take the job anyway, and I made a choice last night to do what needed doing, and I will accept the consequences of both of those choices through the appropriate process. She paused. What I won't accept is being characterized as someone who acted recklessly or outside good judgment, because that characterization is false, and I think everyone in this room knows it. Another silence. Price, who had said very little since the meeting started, said nothing now either, but she was watching Mara with an expression that Farrell noticed and filed. There's a process, Voss said finally, for expedited credentialing review under exceptional circumstances. It exists primarily for situations where a practitioner has demonstrated surgical competency that hasn't been formally recognized by the hospital. It's rarely used, he paused. I'd like to explore it. Mara looked at him. How rarely? She said. Twice in the hospital's 40-year history, Patricia Holmes said, consulting her notebook. Once in 1987, once in 2003. Both occasions, Voss said, involved practitioners with documented specialized backgrounds that hadn't been fully recognized at time of hire. He looked at Mara. I think we can make a reasonable argument that yours qualifies. The room was quiet for a moment, with the specific quality of quiet that arrives when a situation has shifted in a direction that nobody fully anticipated. Mara looked at the table. She had walked into this meeting expecting a fight. She had prepared for a fight, had structured her arguments, anticipated the counter-arguments, had the medical board timeline in her head and the supporting statements and the specific language of the credentialing bylaws. She had been ready to hold ground through a long, wearing institutional process that might or might not produce the right outcome in the end. She had not prepared for the conversation to turn this quickly. She did not trust it. What does expedited review require? She said. Credential verification through your military records, Holmes said. Competency demonstration, which, given last night's documented outcomes and the supporting statements, may be waivable in the formal testing component. Board approval, state notification. She looked up from her notebook. 6 to 8 weeks. And during those 6 to 8 weeks, Voss cleared his throat, you would remain on administrative leave with pay. He said it with the specific cadence of someone announcing a concession they decided on in advance, but wanted to appear to be arriving at in the moment. She looked at him. She looked at Farrell. Farrell met her eyes and said nothing, which was the most honest thing in the room. All right, she said, I'll participate in the review. What she didn't say, and what she thought about on the drive home that evening in the dark, with the road still slightly iced from the previous night's storm, was that she didn't know how to want what was being offered. She had been a trauma surgeon. She had been good at it in the way that very few people are good at anything, not just technically competent, but structurally suited to it, the way certain people are suited to certain conditions, the way some people can sleep in noise that would keep others awake for hours. She had been built for the particular combination of stillness and speed and tolerance for the irreversible that trauma surgery required, and she had known it since her 3rd year of medical school, and she had spent the 9 years of her military career doing exactly the thing she was made to do in the places it was most needed. And then she had stopped, because stopping had felt like the only honest thing left to do. She had operated on Marcus Tilden, Specialist First Class Marcus Tilden, 24 years old, from Baton Rouge, Louisiana, who collected paperback westerns and called his mother every Sunday when communications allowed, on a Wednesday night in a converted schoolhouse in a location she did not think about by name, with 1 light source and 2 units of blood and a bleed that had reached his chest cavity from a shrapnel wound that should have been survivable. She had made 4 decisions in the first 6 minutes that were all correct. She had made 1 decision in the 7th minute that she still did not know how to evaluate, because the information she'd had in the 7th minute had been incomplete, and the decision she'd made based on that incomplete information had been the one he hadn't survived. The Army had found no fault. The Army had given her a commendation 6 months later for a separate action, and she had accepted it and packed it in a box that she did not open. She had left because staying would have required her to believe that she could do this work and not carry Tilden's face into every subsequent operating room, and she wasn't sure that was survivable either. Not in the way that mattered, not in the way that let you be any good to anyone. She had managed 11 months of managed stillness, hands that passed instruments instead of holding scalpels, eyes that watched but did not direct. And then 11 patients had arrived in 3 hours, and she had understood, with a cold and absolute clarity, that the stillness was a thing she had constructed and not a thing she had become. And the distinction mattered. She pulled into her parking spot and sat in the car for a moment. She thought about Oliver. She had called the post-op nursing station before she left the hospital. He was stable. His secondary bleed indicators had been reassessed at 2 p.m. The flagged risk she'd documented on intake had been mild, resolving, nothing that required intervention. He had eaten half a cup of Jell-O and asked when his parents could come back. She sat there another moment. Then she went inside. The board of directors session the next morning lasted 2 hours and 40 minutes and produced a resolution that Voss delivered to Mara by phone at 11:45 a.m. The hospital would support the expedited credentialing process, suspend the medical board notification pending the review outcome, and issue a formal statement characterizing the previous night's events as an emergency response by an experienced medical professional with an extensive surgical background. It was, by any reasonable measure, the outcome she had been arguing for. She thanked Voss, ended the call, and stood in her kitchen for a moment with the phone in her hand. Then her phone rang again. The number was a Denver area code she didn't recognize. She answered it. The voice on the other end was a woman, professional, carefully modulated, identifying herself as a reporter from the Denver Courier, and saying that she was working on a story about the mass casualty event at Callaway Regional 2 nights prior, and had been provided some background information that suggested there was a secondary story worth pursuing, and she was hoping Mara could speak with her. Mara said, "Who provided the background information?" The reporter said she wasn't able to disclose sources. Mara said, "What's the secondary story?" The reporter paused, choosing her words. That a decorated Army veteran with an extensive surgical background has been working as a nurse at Callaway Regional for nearly a year, she said, and that when she saved 11 lives during a mass casualty event, the hospital's first response was to suspend her. Mara's first thought was Drummond. Drummond was young and angry on her behalf, and had probably talked to someone without meaning to create this specific problem. Her second thought was that it didn't matter who had talked. The information was out. "I'm not going to comment right now," Mara said. "I understand. I just want you to know that the story is running tomorrow regardless. If you'd like to be represented in it, I'd appreciate the chance to include your perspective." Mara ended the call. She stood very still for approximately 4 seconds. Then she called Farrell. He answered on the second ring. "The Denver Courier has the story," she said. A pause that was 1 beat too long. "How much do they have?" he said. "Military background, the interventions, the suspension, enough. When does it run?" "Tomorrow." He exhaled. "Voss is going to—" "I know," she said. "That's why I'm calling you first." Another pause. "Mara," he said. His voice had something in it, not quite an apology, but something that was trying to become one. "The suspension. I want you to know that I did not recommend—" "I know you didn't," she said. "That's also why I'm calling you first." She paused. "The story running may not be the worst thing. Voss needs a reason to move faster than 6 to 8 weeks. Right now he doesn't have one." "A front-page story in the Courier would give him one," Farrell said slowly. "Yes," she said. "It would." He was quiet for a moment. "You're not angry about this," he said. "I'm a lot of things," she said. "Angry is somewhere in the list. It's not at the top." "What's at the top?" She thought about it honestly. "Tired," she said. "And something else. I don't have a clean word for it." He didn't push. "I'll call Voss," he said. "We'll meet this afternoon. You should be there." "I know," she said. "I will be." She ended the call and set the phone on the counter. The Denver Courier story running tomorrow was a pressure event. Voss would react to pressure. That was what administrators did. They managed pressure. They found the path of least institutional resistance and moved toward it. If the story ran before the credentialing process was formalized, the hospital's position became significantly more complicated. and complicated positions had a way of resolving in the direction that reduced the complication most efficiently, which might mean fast-tracking the review, or it might mean something else entirely, something she hadn't accounted for. She picked the phone back up and called Price. Price answered immediately. "The courier has it," Mara said. A half-second of silence. "I heard," Price said. "How did you—" "I've been monitoring the situation," Price said, in the tone of someone who has access to information channels they are not going to explain in detail. "Mara, there's something else. Something I didn't tell you yesterday because I wasn't certain, and now I am." Mara's hand tightened slightly on the phone. "Tell me," she said. "The medical board notification that Voss submitted yesterday morning, before the board session, before the suspension was walked back. It was received and processed before the hold request went in. There's a 3-hour gap." Mara was quiet. "Which means," she said carefully, "which means the formal investigation was open before the hospital changed its position," Price said. "The board has an active file. The suspension may have been reversed internally, but the regulatory investigation is running independently, and the investigator assigned to it—" She paused. "The investigator is a woman named Susan Holt. She's been on the medical board for 11 years. She has a record of pursuing scope of practice violations with a particular—" Another pause. "Thoroughness. You're saying the hospital walking it back doesn't close the investigation?" "I'm saying it doesn't close it automatically," Price said. "And I'm saying that Susan Holt received the original notification with the original framing, which described the incident as a nurse performing unauthorized surgical procedures, without the supporting context, without the military record, without the crisis conditions documentation. She opened the file on that basis." Mara stood at her kitchen counter in the thin Colorado winter light. "Can the hospital submit additional context that changes the framing?" she said. "Yes," Price said, "but Holt will decide how much weight it gets. And Holt's record suggests she doesn't love revisions after the fact. She reads initial reports as the most accurate account and treats subsequent submissions as motivated." "Motivated," Mara said. "Her word, from prior cases. She has a history of—" Price stopped. "There's a hearing, Mara, a formal scope of practice hearing before the board. Holt has already scheduled it. 3 weeks. 3 weeks. That's accelerated," Mara said. "Significantly," Price said. "Holt is moving fast. Fast enough that I think the courier story may have already reached her, or will, before end of day." Mara looked at her kitchen wall. There was nothing on it. She had lived in this apartment 11 months, and there was nothing on the walls. "If Holt goes into that hearing with the original framing," she said slowly, "with a narrative that's been set before the supporting documentation is properly entered into the record, then the outcome depends on a board of 5 physicians evaluating a scope of practice violation against a nurse," Price said. "And however it resolves, the process alone puts your nursing license at risk during the proceedings. Which means I can't work," Mara said, "during the hearing process. Even the expedited credentialing is contingent on an active license." "Yes." She was quiet for a long moment. Outside her window, the mountains were clear and cold and very far away. "Dana," she said, "is there anything in the supplemental record, anything in the classified operations documentation, that the Army would be willing to present directly to the board?" A pause. "I was waiting for you to ask that," Price said, "and the answer is complicated." "Tell me the complicated answer." "There's a set of operational records from your 3rd deployment," Price said carefully, "that document the scope and conditions of your surgical work in sufficient detail that no medical board in this country would have a reasonable basis for calling it unauthorized practice. But those records are restricted because the unit designation and the theater details are still sensitive, and presenting them to a civilian regulatory body requires sign-off from a level above my authority." Mara waited. "I submitted the request," Price said, 30 minutes ago. And it requires authorization from the Surgeon General's office," Price said, "which is not a fast process, except—" She stopped. "There's a general officer whose name you'll recognize in the Surgeon General's office right now, who I reached by phone an hour ago, and who has been aware of this situation since last night, and who told me—" A pause that was the longest one yet. "She told me that if Mara Solis needs the full record will be made available." Mara stood very still. There was only one general officer in the Surgeon General's office whose name she would recognize. Brigadier General Watts, she said. Yes, Price said. Patricia Watts, who had been a colonel when Mara deployed the second time, who had read every incident report from the forward surgical team that Mara ran, who had sent a handwritten note after Marcus Tilden died that Mara had read once and then folded into the box with the commendation. She's been following this? Mara said. She has a habit, Price said quietly, of keeping track of the people who served under her. The thing in Mara's chest that she didn't have a clean name for shifted again. The same thing that had moved when Drummond told her about the statement, when Reeves's name appeared at 11:02 p.m., when Tran submitted 12 pages of annotated data. Not gratitude exactly. Something older and less comfortable than gratitude. The feeling of being seen by people who had earned the right to see her and not knowing entirely how to stand in it. There's still the hearing, she said. Yes, Price said. 3 weeks. Susan Holt. And she's not going to make it easy. No, Mara said. She's not. A pause. Mara, Price said, I need to tell you something else, something I found out an hour ago that changes the shape of what we're dealing with. Tell me. Susan Holt, Price said. Her husband is on the board of directors at Callaway Regional. The kitchen was very quiet. His name is Robert Holt, Price said. He's been a board member for 6 years. He was in the session this morning. He voted against the expedited credentialing process. He was the only vote against it. Mara set her hand flat on the counter. He voted against it and lost, she said. 4-1. Yes, Price said. And 40 minutes later, his wife accelerated a scope of practice hearing to 3 weeks. The connection between Robert Holt and Susan Holt was not a secret. It was simply a fact that nobody had thought to look for until now, because nobody had needed to, and that was how certain kinds of power worked. Not through concealment, but through the assumption that no one would bother to trace the lines. Mara stood at her kitchen counter for another 10 seconds after the call ended. Then she picked up her keys. She drove to the hospital, not because there was a meeting scheduled, but because sitting still in her apartment with this information felt structurally wrong, the way it feels wrong to hold something too hot in your bare hands. Movement was not a solution, but it was better than standing at a wall with nothing on it, thinking about how fast a woman named Susan Holt had moved once her husband lost a vote 4-1. Farrell was in his office. He looked up when she appeared in his doorway, registered her expression, and said, "Close the door." She closed it and told him about Robert and Susan Holt. He listened without interrupting. When she finished, he sat back and looked at the ceiling for a moment with the expression of a man doing arithmetic on a problem he wishes someone else owned. You're saying the board investigator who accelerated the hearing is married to the board member who voted against your credentialing this morning, he said. Yes. And the gap between the vote and the hearing acceleration was 40 minutes. Price confirmed the timeline. He was quiet. That's not proof of anything improper, he said. No, she agreed. It's a pattern. Whether it's proof depends on what else the pattern contains. He looked at her. What else does it contain? I don't know yet, she said, but Robert Holt has been on this board for 6 years. His wife has been on the medical board for 11. If there are prior instances where they've moved in coordination around a hospital matter, that's speculation. It's hypothesis, she said. It needs evidence or it's nothing. She paused. Who would know? In this hospital, who would know whether Robert Holt has exercised influence over medical staff decisions before? Farrell looked at her for a long moment. Then he picked up his phone and called Betsy Okafor. Betsy Okafor arrived in Farrell's office 11 minutes later with the particular bearing of a woman who has been asked to come quickly and has correctly inferred that this means she should bring everything she knows rather than just what she's been asked for. She sat down, folded her hands in her lap, and looked at Farrell. Robert Holt, he said. A very small shift in her expression. Not surprise. Something closer to the recognition of a subject she had been waiting to be asked about for some period of time. What specifically? She said. Any instance in the last 6 years where board matters involving his vote corresponded with medical board actions affecting hospital staff. Betsy was quiet for a moment. She looked briefly at Mara. A quick, assessing look that had nothing hostile in it, and then back at Farrell. In 2021, she said, there was a hospitalist physician named Dr. Frank Abernathy. He raised concerns in a board meeting about resource allocation in the emergency department. Specifically, he argued that the staffing model Holt had championed was creating dangerous patient-to-physician ratios. Holt voted to table the discussion indefinitely. 6 weeks later, Abernathy received a notice of investigation from the Colorado Medical Board regarding a prescribing practice that had, to my knowledge, been standard protocol in this department for years. She paused. The investigation took 8 months. No findings of fault, but Abernathy left the hospital during the process and did not return. The room was very quiet. Is that documented? Mara said. The board minutes are public record, Betsy said. The medical board investigation would be in the state database. Investigations that close without findings are still recorded. She paused again. There was also a situation in 2019 involving a department head who publicly opposed a facilities contract that Holt had a financial interest in. That one is more complicated, and I would need to look at what's documentable versus what I know from other channels. Other channels, Farrell repeated. 19 years, she said simply. I've been here 19 years. Farrell looked at Mara. Mara was doing the same arithmetic she'd been doing in her car, but now it had more numbers in it, and the pattern was sharper. A board member who used his wife's regulatory position as a secondary instrument when hospital-level power wasn't sufficient. It wasn't elaborate. It was actually quite simple, the way durable, small-scale corruption usually was. Two people in adjacent institutions, each with authority the other lacked, each providing cover the other needed, and the whole thing sustained by the fact that nobody was ever looking at both of them at the same time. I need to talk to Patricia Holm, Mara said. Patricia Holm was in her office in the compliance wing with 3 separate case files open on her desk and the look of a woman who had been hoping for a quiet afternoon and was revising that expectation in real time. Mara laid out the timeline, Betsy's account of Abernathy. The 2019 situation, the 40-minute gap between the board vote and Susan Holt's hearing acceleration. The pattern of the two moving in coordination around hospital adverse actors. Holm listened with her pen in her hand and did not write anything down. When Mara finished, Holm said, "What are you asking me to do?" "I'm asking you to tell me whether any of this falls within compliance's purview," Mara said, "and if it does, what the reporting pathway looks like." Holm set the pen down. If a board member has been using his position to retaliate against hospital staff through coordination with an external regulatory body, she said carefully, that's a governance issue that goes above the compliance office. It would need to go to the board chair, or, if the board chair is conflicted, to the hospital's external legal counsel and potentially to the state attorney general's office. Is the board chair conflicted? Mara said. The board chair is Margaret Osei, Holmes said. She's been chair for 3 years. She voted for your credentialing this morning. A pause. She and Robert Holt do not have a warm professional relationship. I'm not speculating. It's been noted in meeting minutes more than once. Mara looked at her. Then the reporting pathway starts with Osei, she said. Holm was quiet for a moment. She looked at the pen on her desk. She looked at the files in front of her. She was a compliance officer who had been doing a specific job within a specific institutional lane, and what was being proposed here was a step outside that lane into territory that was more exposed and more permanent. If I file this as a formal compliance concern, she said slowly, it cannot be informally resolved. It becomes a record. It triggers mandatory external notification depending on the findings. And if the findings support what you're describing, she paused. Robert Holt has been on this board for 6 years. He has relationships here. I know, Mara said. I'm not saying I won't do it, Holmes said. I'm saying I want you to understand what it starts. I understand what it starts, Mara said. I also understand what it stops. A silence. Give me the Abernathy case details, Holmes said, and whatever Betsy has from 2019. I'll need to look at the primary records before I can frame a formal concern. I won't file something I can't support. She picked up the pen. And someone needs to contact Dr. Abernathy. I'll do that, Mara said. What? Frank Abernathy was in private practice in Boulder. He answered the phone on the third ring, and when Mara introduced herself and said she was calling about the 2021 medical board investigation, there was a pause on his end that told her everything she needed to know about how much he'd been waiting for this call without believing it would ever come. She explained the situation briefly. He listened. When she finished, he said, "Holt." "Yes," she said. "I could never prove it," he said. His voice had the particular tiredness of someone who gave up fighting something a long time ago and is now being asked to pick it back up. The prescribing thing. It was legitimate practice. It had been our standard protocol. It was never an issue until it suddenly was. And the timing, I noticed the timing. I said something to the department head, and then he stopped. I had a family. I had a mortgage. The investigation took 8 months and cost me $20,000 in legal fees, and I wasn't found responsible for anything, but by the time it was over, I didn't have anything left to fight with. "I'm sorry," Mara said. "Are you going to be able to prove it?" he said. "I don't know," she said honestly, "but I have a compliance officer who's willing to open a formal inquiry and board minutes and a pattern that's becoming easier to see from the outside than it was to document from the inside." A long pause. "What do you need from me?" he said. "A written account of the timeline," she said. "What happened, when, in the order it happened. You don't have to characterize it, just the facts in sequence. My compliance officer will do the rest." Another pause. "Send me an email," he said. "I'll have something to you by tonight." Odd. The Denver Courier story ran the next morning. It was not a small story. It ran above the fold on the digital front page with a photograph of Callaway Regional's exterior and a headline that was accurate and not sensational, which somehow made it worse from an institutional damage standpoint than a sensational one would have been. Sensational could be dismissed. Accurate and restrained had a different kind of staying power. The story described the mass casualty event, the 11 critical survivors, and the role played by a nursing staff member with an undisclosed military surgical background. It described the initial suspension. It described the reversal. It included a statement from Dr. Marcus Reeves, quoted directly with his permission, describing what he had witnessed in OR2. It included a statement from Lieutenant Colonel Price. It did not include a statement from Mara because she had declined to comment, and the reporter had been professional about it, and the absence of her statement made her presence in the story more rather than less significant. By 9 a.m., the story had been picked up by 2 Denver television stations. By 10:30, it had been picked up by the Associated Press wire. Leonard Voss called Farrell at 10:47 and said, "We need to move faster on the credentialing." "We needed to move faster yesterday," Farrell said. "Gregory, the hearing is in 3 weeks, Leonard. Holt's wife." "I'm aware of the Holt situation," Voss said, which meant he had been aware of it for longer than he was now going to claim, or had been briefed very recently and was recalibrating fast. "Patricia is managing the compliance inquiry." "That's a separate track from the credentialing. I need you to convene the credentialing committee." "The credentialing committee has 5 members and 2 of them are on vacation," Farrell said. "Get them on a call," Voss said. "Today." The credentialing committee convened by video at 2 p.m. Mara submitted her military records, the supplemental record that Price had provided, and a summary of her operational surgical experience that Price's office had cleared for civilian disclosure. She also submitted the post-op documentation from the night of the mass casualty event, annotated by Farrell and co-signed by Reeves, Ash, Tran, and Drummond. The committee reviewed in silence for 20 minutes. The chair, a cardiologist named Dr. Renata Sabo, who had been at the hospital for 15 years, asked 2 questions. The first was about Mara's board certification status at time of discharge. Active, not since renewed, but the underlying competency requirements had not changed and the renewal pathway existed. The second was about the specific procedures performed during the mass casualty event and whether the post-op outcomes were consistent with experienced-level surgical practice. Farrell answered the second question before Mara could. "Every patient who received intervention is either discharged or in stable recovery," he said. "The post-op complication rate from those specific cases is 0. If you gave me a list of 10 randomly selected surgical procedures from this hospital over the last year and asked me which ones were performed by a nurse, I could not identify these from the outcomes." Sabo looked at him for a moment. "That's a strong statement," she said. It's an accurate one, he said. The committee voted 3-2 in favor of provisional surgical privileges pending state board notification, a split that would normally have concerned Mara, but the two dissenting votes were based on procedural objections about the timeline rather than objections to her qualifications, and Sabo noted that distinction for the record. Provisional privileges. Conditional. Not full admitting, not independent surgical authority, but enough to practice under supervision while the formal process completed. She drove home that afternoon and sat at her kitchen table and thought about the word provisional and what it contained, and decided it contained enough to work with. Abernathy's written account arrived at 7:14 p.m. It was 8 pages, single-spaced, methodical in the way that physicians write when they are writing for a record rather than for an audience. The timeline was precise. He had kept, apparently, a personal log during the investigation, not for legal purposes, just because writing things down was how he processed events, and he had pulled the relevant entries verbatim. The correspondence between his public opposition to Holt's staffing model and the initiation of the medical board inquiry was 13 days. He had the dates. Patricia Holm read it the same night and filed a formal compliance concern with board chair Margaret Osei at 8:45 p.m. Osei called Holm at 9:30 p.m. and said she had read the filing. She said, "I've been watching Robert Holt for 4 years." She said, "I need everything you have by morning." The morning came with the particular quality that significant mornings have, ordinary on the surface, the light and the temperature unchanged from the day before, and underneath it the sense of something that has been in motion for a long time finally arriving at its destination. Mara was at the hospital at 7:30 a.m., not required to be there. Her provisional privileges required supervised operating, and there was nothing on the schedule that needed her specifically. But she was there anyway, in the same way she'd gone to the hospital the morning after the mass casualty event, because being there was preferable to being elsewhere. She was at the nurses' station outside the surgical wing when Betsy Okafor found her. "Osi called an emergency board meeting," Betsy said, "this morning, an hour ago, about the compliance filing." "About the compliance filing, the Abernathy documentation, and something else." Betsy paused. "There's apparently a 2019 matter that Holmes' office found in the board minutes, a facilities contract dispute. The department head who raised the objection was Dr. Claudia Marsh. She left the hospital in 2020 after a medical board inquiry that also closed without findings. Holm found a third case as well, a pharmacist in 2022. Mara was quiet. 3 cases. Abernathy, Marsh, the pharmacist. 3 people who had publicly opposed Robert Holt's positions and subsequently faced medical board inquiries that opened on accelerated timelines and closed without findings, but caused sufficient disruption that none of them remained at Callaway Regional. 3 cases, and now hers. The difference was that she was still there. "What's happening in the board meeting?" she said. "I don't know the details," Betsy said. But Holt arrived at 7:15. He came in through the side entrance, which he doesn't usually do, and he had a lawyer with him. A lawyer, which meant he had been told enough of what was coming to know he needed one. The board meeting lasted 2 hours and 20 minutes. Mara was not in it. She was in the surgical wing with provisional privileges and a morning case that required her presence, a vascular procedure that Farrell had asked her to assist with, and she had said yes because doing the work was how she knew how to exist in a situation like this, better than pacing corridors and waiting for institutional decisions to resolve themselves. She scrubbed in. She assisted. The procedure was a carotid endarterectomy, a standard case, a patient who was stable and cooperative, a surgery that required precision and patience and nothing else. And for 2 hours she was in the room, and the room was what it had always been. The field, the instruments, the patient, the sequence. And the thing outside the room could wait. She was in post-op documentation when Farrell appeared at the doorway with an expression she hadn't seen on him before. Not the exhaustion from the mass casualty night, not the careful institutional management of the last 3 days. Something cleaner than either of those. Something that looked, improbably, like relief arriving at the end of a very long run. "The board meeting ended," he said. She looked at him. "Robert Holt has resigned from the board of directors," he said, "effective immediately. The resignation was accepted and a formal referral was made to the State Attorney General's office regarding the pattern of conduct identified in the compliance filing. She absorbed that. Is the referral serious, she said, or is it the board managing optics? OC made it, he said, and OC CC'd the Courier's Denver bureau on the formal referral notice. Mara looked at him. She CC'd the press, she said. She CC'd the press, he said, which means it's not a quiet referral that gets filed and forgotten. It's a public referral. There will be a record. He paused. OC has been waiting to do something about Robert Holt for 4 years. I think she was very precise about how she used the opportunity. A silence. And Susan Holt's hearing? Mara said. His expression shifted slightly. Still scheduled, he said. The board's action and the medical board's action are separate processes. Susan Holt's investigation was opened independently, it runs independently, and Robert Holt's resignation from a hospital board doesn't automatically resolve a regulatory inquiry. He paused. But Price submitted the full operational record this morning. Brigadier General Watts signed off on the declassification last night. The complete record, all of it, the deployments, the procedures, the commendations, the Silver Star citation, is now part of your formal hearing file. Mara was quiet. The hearing is in less than 3 weeks, she said. Yes. And Holt, Susan Holt, has had the case for 4 days already with the original framing. Yes. She looked at the post-op notes in front of her. The patient's name was Gerald, 63 years old, a retired high school geography teacher from the northern suburbs. She had looked at his chart when he came in. She had read his history, his medications, his allergies. She had noted that his pre-operative anxiety assessment was elevated and had said something brief to him before the anesthesia, something about the view of the mountains from the north windows of the recovery bay, which was true, and which he had seemed to find useful. She was doing what she'd always done. She was in the work. There's one more thing, Farrell said. His voice had a different quality now, more careful. She looked up. Patricia Holmes' office pulled Susan Holt's full caseload from the medical board public records, he said. Scope of practice cases specifically, over 11 years, he paused. Holt has a 94% disciplinary finding rate on scope of practice cases she personally investigates. Mara held his gaze. That's an unusually high rate, she said. It's an extremely high rate, he said. The statewide average for similar cases is around 60%. Her rate suggests a pattern of case selection, that she's not opening investigations at random. She's opening ones where she's already identified a basis for a finding before the formal hearing. Or ones where the outcome has already been decided, Mara said. He didn't answer that directly. Holm is including the caseload analysis in a supplemental submission to the hearing file, he said. The question is whether the board panel, the other 4 members, will receive it in time to factor it into their evaluation, or whether Holt moves fast enough in the hearing itself to establish the narrative before the full record is. He stopped, because his phone had begun ringing, and he looked at it, and something in his expression changed. It's Price, he said. He answered it on speaker without being asked. Mara stood at the documentation station 3 feet away. Price's voice was controlled in the way that voices are controlled when the information they're carrying is not controlled. The hearing has been moved, she said. Susan Holt just issued a revised notice. She's pulled it forward. How far forward? Farrell said. 48 hours, Price said. The hearing is the day after tomorrow, 9 a.m. A silence. She received the full operational record submission this morning, Mara said. Her voice was steady. She moved the hearing up the same day the complete record entered the file. Yes, Price said. Mara looked at Farrell. He looked at her. The full record was in the file. The Silver Star, the classified deployment details, the hundreds of procedures, the commendation signed by a brigadier general who is now authorized to speak publicly on Mara's behalf. It was all there. Everything that should have made this straightforward, and the investigator who had built her career on 94% disciplinary findings, whose husband had just been forced to resign from the hospital board, had moved the hearing up to 48 hours from now. Not because the record weakened her case, because it threatened to. 48 hours. Mara drove home that evening and did not think about the hearing. She thought about it the way you don't think about something you've decided to handle, by setting it in a specific compartment and leaving it there while the rest of your mind did what needed doing. She made a list. Not a written list, just the internal architecture of one, the kind she had learned to construct in places where paper was a liability and clarity was survival. What she had: the full operational record, now declassified and in the hearing file, the supporting statements from 4 physicians, the post-op data, Abernathy's written account, which was in the compliance filing and would be available to the hearing panel as context for the investigator's conduct if the panel chose to request it. Price, who was in Millhaven and had made clear she intended to remain there until this was resolved. Brigadier General Patricia Watts, who had authorized the record release and Price had indicated, was available to provide a written statement to the board if needed. What she didn't have: enough time to know whether the panel had received and read the full record before Holt structured the morning's opening. A 94% disciplinary rate was not evidence of wrongdoing in a single case. It was context, and context was only as useful as the audience willing to receive it. And she didn't know, not with any certainty, which of the 4 remaining board members were capable of independent evaluation when the investigator they were sitting with had 11 years of institutional authority over each of them. She sat at her kitchen table. She thought about Marcus Tilden for the first time in several months without meaning to. Not the operating room, not the 7th minute, just his face, which she had not forgotten and was not going to forget, which she had stopped expecting to forget sometime in the 2nd year after his death. He had been 24 years old, and he had collected paperback westerns and called his mother on Sundays when the communications allowed, and he had trusted her with his life in the way that soldiers trust the person responsible for keeping them alive, which is a complete and uncomplicated trust that has nothing provisional about it. She thought about the fact that 11 people were alive because she had walked into rooms 2 nights ago and done the things she had been trying to stop being. She thought about the fact that she had not been able to stop being it, that the schoolhouse and the denied area and the forward surgical bay and the 4 times the structure took fire, and the hundreds of decisions made in conditions that no review board had ever evaluated and no credentialing committee had ever seen. All of it had not left her when she asked it to. It had simply waited. She thought about Oliver, 9 years old, who had eaten Jell-O and asked when his parents could come back. She went to bed at 10 and slept for 7 hours, which was more than she'd expected. The hearing was held in a conference room on the 4th floor of the Colorado Medical Board's Denver office. It was a 2-hour drive from Millhaven. Mara arrived at 8:15 a.m. with Price beside her and an attorney named David Okafor, no relation to Betsy, who practiced medical licensing law in Denver and had taken the case 40 hours ago after a phone call from Lieutenant Colonel Price that he had described, when he called Mara to introduce himself, as the most interesting call he had received in a professional career spanning 23 years. The conference room was standard institutional. A long table, neutral carpet, windows that looked at another building, 5 board members seated on one side, a court reporter at a small desk near the wall, Susan Holt at the far end of the long side, with a folder in front of her and the composed, calibrated expression of someone who has done this many times and expects to do it the same way again. Mara sat across from the board. Price and Okafor flanked her. She looked at Holt once, directly, and then looked at the board members, and that was where her attention stayed. Holt opened with a framing statement that was precisely what Mara had expected: a scope of practice violation, clearly documented, in which a registered nurse had performed operative procedures in a hospital setting without the surgical privileges required under Colorado state licensing law. She cited the incident reports, the OR logs, the specific procedures. Her voice was flat and factual, and the flatness was doing rhetorical work. It suggested that the case was simple, settled, requiring only the board's formal confirmation of what the evidence plainly showed. She spoke for 11 minutes. When she finished, the board chair, a vascular surgeon named Dr. Carl Weimer, who had been on the panel for 6 years, looked at Mara's side of the table and said, "Response." David Okafor stood. He did not begin with Mara's military record. He began with the mass casualty declaration. On the evening in question, he said, Millhaven County issued a mass casualty declaration at 6:23 p.m. Under Colorado Statute 25-3.5-704, a declared mass casualty event activates emergency medical response protocols that modify the standard scope of practice framework for all medical personnel operating within the affected facility. He placed the statute on the table. Under subsection C of that provision, credentialed medical personnel acting in direct response to a declared mass casualty emergency may extend their practice beyond their standard license scope. When doing so is necessary to prevent imminent patient death, and no licensed practitioner of appropriate specialty is immediately available. He paused. All three interventions for which Ms. Solis is being investigated occurred during the mass casualty window, in situations where attending physicians either confirmed they were unavailable or actively requested her assistance. The statutory framework that Ms. Holt's investigation is based on did not apply. The room was not quiet in the way rooms are quiet when nothing is happening. It was quiet in the way rooms are quiet when everyone is recalibrating. Susan Holt's expression did not change, but her hand moved, a small, involuntary shift, to the edge of her folder. Weimer looked at Holt. Was the mass casualty statute considered in the scope of practice framing? The statute applies to emergency medical service personnel in the field, Holt said, not to hospital-based staff. Subsection D, Okafor said, explicitly includes hospital-based personnel during a facility-level mass casualty response. The 2018 amendment. I have the legislative history if the board would like to review it. He placed it on the table. One of the other board members, a woman on Weimer's left, an emergency medicine specialist named Dr. Anita Brower, picked up the statute and began reading. Her expression was the expression of someone reading something they should have been shown before now, and are noting that they weren't. The hearing took 3 hours and 40 minutes, which was significantly longer than a standard scope of practice proceeding. This was because David Okafor was systematic in a way that did not allow shortcuts, and because the full operational record, all of it, Silver Star citation included, Brigadier General Watts's written statement attached, required time to enter into the formal record, and because 2 of the board members had questions that were not perfunctory. Price testified for 22 minutes. She spoke without notes, in the direct declarative cadence of someone who has briefed under pressure in rooms far less comfortable than this one. She described the forward surgical team, the operational conditions, the 4 fire incidents. She described the surgical volume and the complexity range. She said plainly that Captain Solis's surgical competency under field conditions had exceeded what most civilian trauma surgeons would encounter in a decade of practice, and that the Army Medical Corps had recognized this through the highest commendations available to a non-combat arms officer. Then she said something that was not in any document and that nobody had asked her to say. I have been in medicine for 26 years, she said. I have worked with surgeons trained at the best programs in this country and abroad. What Captain Solis did in that forward surgical bay on 4 occasions while the structure was under active fire, with inadequate resources and no backup, is not something you can assess by looking at a civilian license category. It is not something a scope of practice chart was designed to capture. I am asking this board to recognize that the framework being applied here was built for a category of situation that is not the situation you are evaluating. She sat down. Dr. Brower, the emergency medicine specialist, looked at Susan Holt. Ms. Holt, she said, I want to understand the investigation timeline. The initial notification was received from Callaway Regional on a specific date. The hearing was originally scheduled and then the schedule was revised. Can you walk me through the basis for accelerating the hearing? Holt said, I determined that the case warranted expedited review given the clear scope documentation in the initial report. The hearing was accelerated the same day the full military record was added to the file, Brower said. A silence. That's a coincidence of timing, Holt said. Is it? Brower said. It was not phrased as a question. Weimer was looking at his own documents. He was looking, Mara could see from across the table, at something that had been included in the supplemental submission, the caseload analysis that Patricia Holm had compiled, 94%, 11 years. Ms. Holt, he said, your case closure rate for scope of practice investigations you personally manage is significantly above the board average. Can you speak to that? For the first time, something moved in Holt's composure. a small tightening around the eyes that lasted less than a second and then was gone. "I'm selective about the cases I take," she said. "I open investigations when I believe the evidence supports a finding. I don't open investigations speculatively." "The Abernathy matter," Brower said. 2021. That was a case you investigated personally. It closed without findings. Cases close without findings when the evidence doesn't support. It was opened 13 days after Dr. Abernathy publicly opposed a staffing position supported by your husband at Callaway Regional's board, Brower said. The room was extremely still. "My husband's activities are not the Marsh matter," Brower said. 2020. Opened 6 weeks after Dr. Marsh raised objections to a facilities contract your husband had a financial interest in. She set the paper down. "The 2022 pharmacy matter. Robert Holt voted, in the same month that investigation opened, on a hospital policy directly affecting the pharmacist's department." "You're describing a pattern that doesn't—" "I'm describing a timeline," Brower said. 3 cases, 3 timelines, and now a 4th. "And your husband resigned from the Callaway Regional Board of Directors yesterday morning under a formal compliance referral to the State Attorney General's office." She looked at Holt directly. "I have to ask you, Ms. Holt, whether you believe you can evaluate this case without a conflict of interest." Susan Holt's composure did not shatter. It was not that kind of moment. It was instead a slow, visible, terrible loss of altitude. The expression of someone whose constructed position has been undermined at the foundation and who is now managing the vertical distance between where they are and where they are going to end up. "I have no conflict of interest in this case," she said. Her voice was still controlled, but it was controlled the way a structure is controlled when the supports have been removed, and it is still standing on inertia. "I'd like to request a recess," Weimer said. The recess lasted 40 minutes. Mara sat in the hallway outside with Price and Okafor and a cup of coffee she didn't drink. Price said nothing. Okafor reviewed his notes. The hallway had the particular institutional hum of a building full of processes in various stages of resolution, none of them visible from the outside. She thought about Holt in that room. She did not feel triumphant exactly. What she felt was more complicated and less clean. A recognition that the person across the table from her had spent 11 years building something, and that what she'd built was small and mean, and had hurt specific people in specific ways, and that the fact of it coming apart now was correct and necessary, and still somehow not simple. Corrupted things were built by people who had convinced themselves they were doing something else, and the moment when the conviction failed was not a moment she could find entirely satisfying to witness. But the 3 people who had left Callaway Regional, Abernathy, Marsh, the pharmacist, were real, and their losses were real, and the correction that was happening in that room mattered even if the shape of it was unclean. She drank some of the coffee. Okafor looked up from his notes. "You know how this is going to resolve," he said. "I think I know," she said. "The statute alone closes it," he said. "The mass casualty framework. The rest, Price's testimony, the record, the commendations, that's architecture around a legal argument that stands on its own." He paused. Brower's line of questioning about Holt was not on our agenda. She did that independently. "I know," Mara said. "Good board members," he said, with the quiet professional appreciation of a man who had sat across from bad ones. The door opened. Weimer appeared in the doorway. "We're ready to resume," he said. The board reconvened, and Weimer read the panel's determination into the record. The scope of practice complaint against Mara Solis was dismissed. The basis for dismissal was the mass casualty statute, operative at the time of all 3 interventions, under which her actions fell within the emergency extension provision and did not constitute a violation of her nursing license. The determination was unanimous. The panel further noted, for the record, that Ms. Solis's demonstrated surgical competency, documented through her military service record and corroborated by the post-operative outcomes data and the testimonies of 4 attending physicians, represented a background that had not been adequately considered at the time of her hire or during the initial institutional review of the incident. Weimer then said something that was not part of the formal determination and that he read without looking down at his notes. "This panel would also note," he said, that the conduct of this investigation will be referred to the Medical Board's Internal Review Office for evaluation of potential procedural irregularities, including the basis for case acceleration and the question of investigator conflict of interest. That review will be conducted by a separate panel with no connection to prior cases involving the parties identified in today's record. He paused. Ms. Solis, you're free to go. She nodded once. She stood up, shook Okafor's hand, and walked out of the room ahead of Price, because she needed approximately 30 seconds of corridor before she could trust her face entirely. She got 35 check. The Medical Board's internal review of Susan Holt's conduct completed 6 weeks later. The findings were not published in full. The board's internal disciplinary process was not public, but the outcome was, because outcomes required notification. Susan Holt was formally censured for procedural misconduct in 3 prior cases, including the Abernathy matter. She was removed from the position of lead investigator for scope of practice cases for a period of 2 years. She was not removed from the board entirely, which was an outcome that Mara thought was insufficient and said so to no one, because saying so would not change it and would only cost energy she had better uses for. Frank Abernathy received a formal written apology from the medical board. He told Mara in an email that he had framed it and put it on the wall of his private practice in Boulder, not because it was satisfying, but because his kids had asked why it was there, and he had been able to tell them the story, and that had been worth more than the apology itself. She read that twice. Robert Holt's referral to the state attorney general's office was not resolved quickly. These things rarely were, but the referral was public and the documentation was thorough, and the Courier ran a follow-up story that laid out the 3 cases with names and timelines in the kind of detail that does not fade easily from institutional memory. Robert Holt did not seek another board position. The hospital's board adopted a new conflict of interest policy requiring members to disclose employment and family relationships with state regulatory bodies, a policy that had not existed before and that OSE pushed through in the first regular session after Holt's resignation, with 4 votes in favor and no one voting against because there was no one left to vote against it. Mara's credentialing completed in 5 weeks, 1 week ahead of the revised estimate. The committee vote was 5-0. Szabo called her personally to tell her which was not standard protocol, and which Mara appreciated in the uncomplicated way she appreciated things that were genuine. She was appointed to the surgical staff as a trauma surgeon, not provisional, not conditional, full privileges, attending status, independent surgical authority. Farrell told her in his office, with the door open because there was no reason to close it anymore. There's a conversation we should have, he said, about what this role looks like going forward. Scope, supervision, structure, on-call. I know what the role looks like, she said. I've been watching it for 11 months. He almost smiled. It was the closest she'd seen him come to it in all the time she'd known him, which was not long in calendar terms and felt considerably longer than that. I owe you an apology, he said. You've been building to that for a while, she said. I know. He looked at her. Not the way he had looked at her in the hallway during the mass casualty event, not with the specific assessor's attention of someone trying to categorize what they're seeing, just directly, like a person looking at another person. I spent a year not seeing you. I've thought about what that cost, and it's not an abstract calculation. There were things you could have contributed to this department, to the patients in this department, that didn't happen because I didn't ask. She let him finish. I accept the apology, she said, and I want to be honest with you about something. He waited. I wasn't easy to see, she said. I made sure of it. I kept my head down and I passed instruments, and I didn't offer anything I wasn't asked for, because I was afraid of what would happen if I did. She paused. That's not on you entirely. I own part of the distance. He was quiet for a moment. Why were you afraid? He said. She thought about it honestly. Because I wasn't sure I was still her, she said. The person who could do this. I'd been away from it for long enough that I wasn't certain the gap hadn't changed something essential, and I didn't want to find out I'd lost it. She paused. Turns out you don't lose it. It just waits. She was in the OR for the first time as an attending surgeon on a Tuesday morning in March, 6 weeks after the night of the storm. The patient was a 57-year-old woman named Dolores, a retired schoolteacher with a ruptured abdominal aortic aneurysm who had been transferred from a smaller facility 40 miles north, and who was, when she arrived, in the narrow window between fixable and not. The on-call resident who had triaged her was a third-year named Sofia Gutierrez, who had flagged the transfer with the specific urgency of someone who has correctly read a situation and knows that correct reading is only half the work. Mara scrubbed in. The OR felt the same way it had always felt. The temperature, the light, the specific quality of attention in the room when everyone is oriented toward the same thing. She had been in hundreds of operating rooms across 3 countries and 2 continents and 1 converted schoolhouse in a denied area, and they all had this in common. The moment before the first incision, when the room becomes what it is, when everything outside it becomes irrelevant, when the person on the table becomes the only organizing fact. She made the first incision at 8:44 a.m. The procedure took 2 hours and 17 minutes. There were 2 complications: a secondary bleed at the proximal anastomosis site that required rerouting, and a blood pressure instability in the 3rd quarter that the anesthesiologist managed with the competent, slightly tense focus of someone handling something they'd handled before and were not enjoying. Neither complication was catastrophic. Both were managed. Dolores went to recovery at 11:03 a.m. Mara was in the scrub sink when Sofia Gutierrez appeared beside her. The resident had been in the OR for the full procedure, observing, which Mara had permitted without explaining why, because residents learned more from watching than from being told what to watch. That reroute on the secondary bleed, Sofia said, that wasn't in the procedure plan. No, Mara said. How did you know to go there? Mara thought about how to answer that honestly. The pressure was dropping in a pattern that didn't match where we'd already controlled, she said. When the pattern doesn't match the expected source, you look somewhere you weren't planning to look. She rinsed her hands. That's not a technique, that's just paying attention. Sofia was quiet for a moment. Is that something you can teach? She said. Mara looked at her. Yes, she said. It takes a while, but yes. Quote, she built the residency training component over the next 4 months. It was not a formal program initially. She didn't have the institutional weight for that yet, and she knew it, and she didn't push for what the situation couldn't yet support. She started with case reviews. Twice weekly, voluntary attendance in the small conference room adjacent to the surgical wing. She pulled the mass casualty event cases, all 11 of them, and worked through the decision points with whatever residents and junior attendings showed up, not as a retrospective of what she had done, but as a structured analysis of what the situation had required and why, what the alternatives had been, and what they would have cost. Drummond came every time. He sat in the back and said little and took notes and was, she gradually understood, doing the specific work of someone who has identified a significant gap between who they are and who they need to become, and has decided to close it systematically. She respected that. In the uncomplicated way she respected people who chose the harder version of a thing when an easier version was available. She told him so, once, briefly, after a session. He said he appreciated it in the way that young people say they appreciate things when they are surprised to be seen by someone they respect, and she let it be what it was. The training program became official in September, recognized by the hospital's education committee as an emergency trauma decision-making curriculum. Osei attended the inaugural session. Farrell attended the second. By the end of the year, attendance was mandatory for all second-year residents rotating through the surgical department, which was not something Mara had asked for, but accepted as the evidence that something she had built was worth requiring. She thought about Marcus Tilden less often. Not because she had resolved the 7th minute, she had not, and she did not expect to say, but because she had found, gradually and without announcement, that the 7th minute had taken its place among the other things she carried rather than defining the space around everything else. It was still there. It always would be. But it had stopped being the largest thing in the room. She had spent 6 years trying to become small enough to keep it contained. She understood now, with the kind of understanding that arrives not as revelation, but as the slow accumulation of evidence, that containment had never been the right approach. You didn't make the large things smaller by making yourself smaller. You made yourself large enough that the thing could exist inside you without occupying all of you. You kept working. You put your hands in the field, and you made the right call, and sometimes you made the wrong one, and you lived with both of them, and you kept showing up. Oliver came back to the hospital in April for his 6-month follow-up. He was walking without difficulty. His pelvic fracture had healed cleanly. He was taller than he'd looked in the bed. 9-year-olds are always smaller lying down than standing up. And he was wearing a t-shirt with a dinosaur on it that he had apparently worn on purpose because he'd told his mother it was his lucky shirt. His mother had wanted to meet the people who had treated him, the nursing staff, the surgical team, all of them. It was the kind of meeting that hospitals scheduled and patients' families needed, and that took place in a small conference room with photographs and sometimes tears, and Mara had been warned by the patient coordinator that Oliver's mother was, quote, an emotional person. She was. She held Mara's hands and said things that Mara let wash over her without trying to answer, because there were no adequate answers. And because the woman in front of her was not looking for answers, she was looking to stand in the presence of the people who had kept her son's heart beating long enough to become someone who wore lucky dinosaur shirts to follow up appointments. And the only response to that was to be present and let her have what she came for. Oliver, for his part, was primarily interested in whether the hospital had vending machines. Mara told him it did. She told him where they were. He looked at her with the frank, uncomplicated evaluation of a child who has not yet learned to manage his assessments. "Were you the one who fixed me?" he said. "I helped," she said. "A lot of people helped." "Mom said one of them was an army person," he said. "I was in the army," she said, "a while ago." He considered this. "Did you have a gun?" he said. "I had a scalpel," she said, "which is the army thing I used more." He seemed to find this acceptable and went back to asking about the vending machines. Beecham. In the end, the thing that stayed with her was not the hearing or the board vote or the credentialing certificate on the wall of her office. An office, she noted, that she had actual things on the walls of now, not many, but some, or even the surgical privileges that let her stand at the head of an operating table on her own authority and make the call. What stayed with her was the moment in OR 1, 11 months after she had arrived at this hospital, as the person nobody thought to ask about, when Paul Drummond had stepped aside with his hands in someone's abdominal cavity and looked at her with the specific expression of a man who has run out of road, and she had said, "Move your hands left," and he had moved them. Not because she had a certificate on the wall, not because a committee had voted, not because anyone in that room had any idea who she was or what she had done or where she had come from, because the patient was dying and she was the one who could help, and that was the oldest calculation she knew. Older than rank, older than license, older than every institutional framework built to manage the question of who was allowed to do what, in what room. She had walked into that hospital as a person who had decided, for reasons that made sense to her at the time and that she no longer fully agreed with, to make herself invisible. She had spent 11 months invisible. She had been talked about as furniture, scheduled around like a useful object, seen in the specific limited way that people see things they have decided in advance are not important. And then the storm had come, and the highway had given way, and 41 people had arrived at a hospital that was not ready for them, and the visibility she'd surrendered for 11 months had turned out to be irrelevant. Not because someone had finally decided to see her, because a situation had arisen that stripped away every preconception and left only the question that actually mattered: who in this room knows what to do? She had known what to do. She had always known. The lesson, if there was one, and she was cautious about lessons, because life was not a teaching tool, and reducing it to one was a way of making it smaller than it was. The lesson was not that quiet people were secretly great, or that overlooked women always turned out to be heroes, or that institutions eventually recognized their mistakes and did the right thing. Sometimes those things were true, and sometimes they weren't, and the variation was too wide to be comforting. The lesson, if she had to name one, was simpler and harder than any of that. It was that you could not help anyone, in any room, in any crisis, from a position of deliberate invisibility. The hiding was understandable. The reasons for it were real. But the hiding had a cost, and the cost was not paid by her alone. She had come back, not because the world had finally decided she deserved to, but because 11 people were dying, and the person who could keep them alive happened to be standing in the hallway. She had come back because she was still herself. She had always been herself. That was the thing nobody could take from her, not the board, not the investigator, not the administrator with his liability calculations, not the doctor who spent a year seeing furniture where there was a person. They could manage her, contain her, review her, credential her, and suspend her, and through all of it she had remained, underneath every category they placed her in, exactly who she had been when she walked out of that schoolhouse, in a country she wouldn't name, carrying a loss she wouldn't put down, heading toward a quieter life that turned out not to be possible. Because some people are not built for quiet. They are built for the moment when the alarms go off, and the room needs someone who has already been to the far edge of things and knows the way back. Mara Solis had spent 6 years trying not to be that person. On a Tuesday night in February, in a hospital in Mill Haven, Colorado, during the worst storm in a decade, she found out she still was. She always had been, and she was never going to apologize for it again.